You have choices when you shop for health insurance. If you're buying from your state's marketplace or from an insurance broker, you'll choose from health plans organized by the level of benefits they offer: bronze, silver, gold, and platinum. Bronze plans have the least coverage, and platinum plans have the most. If you are under 30, you may also be able to buy a high-deductible, catastrophic plan. How are the plans different? Each one pays a set share of costs for the average enrolled person. The details can vary across plans. In addition, deductibles, the amount you pay before your plan picks up 100% of your healthcare costs, vary according to plan, with the least expensive carrying the highest deductible. Platinum covers 90% on average of your medical costs, you pay 10%. Gold covers 80% on average of your medical costs, you pay 20%. Silver covers 70% on average of your medical costs, you pay 30%. Bronze covers 60% on average of your medical costs, you pay 40%. Catastrophic policies pay less than 60% of the total average cost of care. Catastrophic plans must also cover the first 3 primary care visits and preventive care for free, even if you have not yet met your deductible. You will also see insurance brands associated with the care levels. Some large national brands include Aetna, Blue Cross Blue Shield, Cigna, Humana, Kaiser, and United. Each insurance brand may offer one or more of these 4 common types of plans. Take a minute to learn how these plans differ. Being familiar with the plan types can help you pick one to fit your budget and meet your healthcare needs. To learn the specifics about a brand's particular health plan, look at its summary of benefits. An HMO delivers all health services through a network of healthcare providers and facilities. With an HMO, you may have the least freedom to choose your healthcare providers, the least amount of paperwork compared to other plans, a primary care doctor to manage your care and refer you to specialists when you need one, so the care is covered by the health plan. Most HMOs will require a referral before you can see a specialist. What doctors you can see? Any in your HMO's network. If you see a doctor who is not in the network, you'll have to pay the full bill yourself. Emergency services at an out-of-network hospital must be covered at in-network rates, but non-participating doctors who treat you in the hospital can bill you. What you pay. Premium. This is the cost you pay each month for insurance. Deductible. Your plan may require you to pay the amount of a deductible before it covers care beyond your essential benefits. When you have reached those amounts, your health plan will pay 100% of charges. Copays and/or co-insurance for each type of care. A copay is a flat fee, such as $15, that you pay when you get care. Coinsurance is when you pay a percent of the charges for care, for example 20%. These charges vary according to your plan and they are counted toward your deductible. Paperwork involved. There are no claim forms to fill out. With a PPO, you may have a moderate amount of freedom to choose your healthcare providers. More than an HMO, you do not have to get a referral from a primary care doctor to see a specialist. Higher out-of-pocket costs if you see out-of-network doctors versus in-network providers. More paperwork than with other plans if you see out-of-network providers. What doctors you can see? Any in the PPO's network. You can see out-of-network doctors, but you'll pay more. What you pay. Premium. This is the cost you pay each month for insurance. Deductible. Some PPOs may have a deductible. You will likely have to pay a higher deductible if you see an out-of-network doctor. Copay or coinsurance. A copay is a flat fee, such as $15, that you pay when you get care. Coinsurance is when you pay a percent of the charges for care, for example 20%. Other costs. If your out-of-network doctor charges more than others in the area do, you may have to pay the balance after your insurance pays its share. Paperwork involved. There's little to no paperwork with a PPO if you see an in-network doctor. If you use an out-of-network provider, you'll have to pay the provider. Then you have to file a claim to get the PPO plan to pay you back. Exclusive Provider Organization (EPO). With an EPO, you may have a moderate amount of freedom to choose your healthcare providers. More than an HMO, you do not have to get a referral from a primary care doctor to see a specialist. No coverage for out-of-network providers. If you see a provider that is not in your plan's network, other than in an emergency, you will have to pay the full cost yourself. Lower premium than a PPO offered by the same insurer. What doctors you can see? Any in the EPO's network. There is no coverage for out-of-network providers. Premium. This is the cost you pay each month for insurance. Deductible. Some EPOs may have a deductible. Copay or coinsurance. A copay is a flat fee, such as $15, that you pay when you get care. Coinsurance is when you pay a percent of the charges for care, for example 20%. Other costs: if you see an out-of-network provider, you will have to pay the full bill. Paperwork involved: there's little to no paperwork with an EPO. A POS plan blends features of an HMO with a PPO. With POS plan, you may have more freedom to choose your healthcare providers than you would in an HMO. A moderate amount of paperwork if you see out-of-network providers. A primary care doctor who coordinates your care and who refers you to specialists. What doctors you can see. You can see in-network providers your primary care doctor refers you to. You can see out-of-network doctors, but you'll pay more. What you pay: premium. This is the cost you pay each month for insurance. Deductible: your plan may require you to pay the amount of a deductible before it covers care beyond preventive services. You may pay a higher deductible if you see an out-of-network provider. Copays or co-insurance: you will pay either a copay, such as $15, when you get care, or co-insurance.